Allosteric integrase inhibitors, alignase. HIV-1 preferentially integrates into actively transcribed gene-dense regions. This selectivity is driven by direct interaction between HIV-1 integrase and the lens epithelium, derived growth factor, LEDGF/P75, a host protein that acts as a transcriptional coactivator, binding various proteins to active transcription units through recognition of the trimethylated histone H3 at lysine 36, H3K36Me3, 29. Alignase, also referred to as legends, non-catalytic site integrase inhibitors, CINI, or multimeric integrase inhibitors, MINI, bind to HIV-1 integrase at the integrase LEDGF/P75 interaction site, perturb the viral host protein interaction, and inhibit HIV-1 integration, 30-31. As expected by an HIV-1 integrase inhibitor, the alignase CX14442 was found to reduce the number of integrated proviruses. However, CX14442 also retarget the site of residual HIV-1 integration away from active chromatin, 32. Specifically, proviruses were integrating into less gene-dense regions with a more repressive epigenetic environment, and were shifted away from H3K36Me3, which lowered HIV-1 transcription. Similar results were noted with GS9822, also an aligni, in that residual provirus was both more latent and refractory to reactivation, and were integrated away from genes and gene-dense chromatin, resulting in a more repressive heterochromatin environment, 33. Collectively, these studies suggest that if HIV-1 infected individuals are treated early with ART regimens that include an aligni, the replication-competent viral reservoir in resting CD4 plus T cells will be transcriptionally impaired, thus mimicking a locked phenotype. As described above, numerous diverse approaches have been identified to elicit a block and lock phenotype to inhibit reactivation of latent HIV-1 infection in CD4 plus T cells. These approaches include small molecules, nucleic acids, and recombinant proteins. Currently, it is unknown whether any single approach will deliver sufficiently long-term silencing of latent proviruses to facilitate a functional HIV-1 cure. As such, combination studies using two or more approaches should be rigorously explored in vitro and in appropriate animal models. While some of the therapeutic agents discussed in this application have been tested in humanized mice models of HIV-1 infection, none have progressed to clinical trials, with the exception of the JAK inhibitor ruxolitinib. However, it is not known whether ruxolitinib treatment resulted in block and lock phenotype in the clinical trial, as this measurement was not included as an endpoint in the study. A key issue for many of the therapeutic agents described in this review relates to target specificity as well as their impact on normal cell function. For example, small molecules that target epigenetic proteins or cell signaling pathways will fundamentally alter the functioning of other cellular processes, which, in the long term, may promote toxicity or adverse events in humans. In this regard, molecules that specifically target viral proteins, e.g. DCA or alignase, may have a therapeutic advantage. To this end, to effectively develop a block and lock functional cure strategy, the field requires the following advancements. I. The discovery and development of potent molecules with appropriate safety and pharmacokinetic/pharmacodynamic properties such that they can be used clinically. 2. The development of delivery systems for these molecules that specifically target latent reservoir cells. And 3. Appropriate clinical trials to assess efficacy and safety in HIV-1 infected individuals.